Now, private hospital operators are calling for a review of the government's new vaccine procurement policy, claiming that the high vaccine prices set for the private sector and a cap on service charge will make it unviable for them. Milind Sharma breaks down the details for you.
This first drive-through vaccination center in Delhi was inaugurated to vaccinate Delhi's population. But after the union government capped vaccine prices in private hospitals, this drive-through center is being shut down by the hospital.
जो नई प्राइस कैपिंग आई है, उसके कारण ये हमारे लिए थोड़ा अनवायबल हो गया है, जबकि पिछले 15 दिन से हमने इसको लगातार चलाया और हम इसको और भी चलाना चाहते थे, लेकिन अभी फिलहाल हमें इसको बंद करना पड़ेगा.
Fortis Healthcare has also issued a similar statement seeking a review of the government's new policy on price cap for private facilities. It said, and I quote, "We would urge the vaccine prices for private sector be reviewed. Unfortunately, the cap of service charge at 150 rupees will not cover additional costs incurred for off-site vaccination camps. We urge the government to consider a higher charge for off-site camps to enable expanded coverage." The government has capped the prices of Serum Institute of India's Covishield at private COVID vaccination centers at 780 rupees per dose. It capped the prices of Bharat Biotech's Covaxin at 1,410 rupees per dose and Russia's Sputnik V at 1,145 rupees per dose. It's also said that private hospitals cannot charge more than 150 rupees for administering a dose. Healthcare industry bodies say the centre should procure all the vaccines.
We urge Prime Minister to procure 100% vaccine from the manufacturers and provide 50% vaccines to the private sector. AHPI, for example, have 11,000 hospitals, many of which are located in Tier 3 towns. They will be able to provide vaccines to the people and overcome the hesitancy.
This would help even small private hospitals to procure doses to vaccinate in small towns as well as rural India.
The central government has made it very much clear that 75% of the COVID-19 vaccine will be made available to the government sector and rest 25% will be made available to the private hospitals. Yet the government has made it clear, but there is no official channel from where the smaller hospitals can procure the COVID-19 vaccine.
Healthcare body sources have said that it seems private hospital concerns have been completely ignored in the new policy. And the Union Health Ministry has told states that strict action needs to be taken against those that are overcharging for vaccines. While we have conveniently forgotten, for several weeks, it was the private hospitals that were procuring higher doses from the central government to vaccinate at least those who could afford to get inoculated in the country, while states miserably failed to procure these doses. In New Delhi with Sneha Modani, this is Milind Sharma for India Today.